Address on coronavirus, and here he is. Let's listen in.
We'll be hearing from you just here in a moment, and we have Lieutenant Governor Crouch, who's got 3 different grant programs to talk about. Really excited about that. A lot of progress in a short amount of time. And then we've also have Dr. Sullivan, who will be with us, and really proud of the efforts of so many people getting on the phone and making sure that we have the funding available. And Dr. Sullivan, maybe you can kind of get into the weeds on everything that went into making sure that our students, as they go back to school, have access to food at the very least. And so excited to hear about the progress that's been made with multiple agencies getting involved on that front. But before we get to that substance, I did want to share that going forward, we started this months ago. And when we were at a stay-at-home posture, we were doing these daily, quite frankly, and then as we progressed, we went to 3 times a week, 2 times a week, and then weekly, where we find ourselves today. But as more testing and more tracing and our ability improved to control the spread, we were able to, again, get it down to once a week. We'll still be doing these weekly updates. They'll just be in a different venue. Dr. Box will still be providing weekly, Wednesday, 2:30. I'll be with her, so we're calling a little bit of an audible, but we'll be on our social media channel starting next Wednesday at 2:30, and then you'll make yourself available, as will everyone else that you've heard from over the last several months. We'll make ourselves available, whether it's Lieutenant Governor or Homeland Security or NDOT, Department of Workforce Development, just every agency that has anything to do directly or indirectly with our COVID-19 response and recovery will still be available. But the weekly update will center on our health indicators, and then you'll open it up for questions from the media, and we'll continue to make sure that we're giving the public and citizens in all 92 counties the latest updates on our response and recovery. With that, Dr. Box, if you want to jump right into what is our latest in terms of our health indicators.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 965 additional cases of COVID-19 in Indiana, which brings our total to 120,019, the number of Hoosiers known to have had COVID. We also saw 20 additional confirmed deaths. To date, 3,405 Hoosiers have died of COVID-19, and another 227 are believed to have died from this disease based on their clinical diagnosis. Our 7-day positivity rate for individuals tested was 4.2% as of September the 23rd, while the cumulative rate for all tests is 5.8%. You've heard all these data points every week and see them daily on our dashboard. But I want to remind Hoosiers that we are still following the 4 guiding principles that the governor outlined in May when he launched the Back on Track plan. Those are: the number of hospitalized COVID-19 patients statewide has decreased for 14 days. The state retains its surge capacity for critical care beds and ventilators. The state retains its ability to test all Hoosiers who are COVID-19 symptomatic, as well as healthcare workers, first responders, and frontline employees. And health officials have the systems in place to contact all individuals who test positive for COVID-19 and expand contact tracing. So let's look at these one by one. First, the number of hospitalized COVID-19 patients. As you can see here, 975 people were hospitalized for COVID-19 or with symptoms of COVID as of yesterday. The number of patients admitted each day was 64 on September 25th, down from 94 about a month ago. Secondly, we said the state needed to retain its surge capacity for critical care beds and ventilators. We currently have about 37% of our ICU beds available, and we have more than 80% of ventilators available. We also said the state must retain its ability to test all Hoosiers who are COVID-19 symptomatic, as well as healthcare workers, first responders, and frontline employees. As I noted earlier, more than 2 million tests have been done, representing more than 1.37 million unique individuals. Our testing capacity is greater than it's ever been, thanks to OptumServe, partnerships with our local health departments, pharmacies, and other healthcare providers and private companies. However, there's an important caveat. All the testing availability in the world doesn't do any good if people aren't willing to get tested. We've seen some of our sites experience significant drop-offs in testing, and the number of people who have registered to participate in the Fairbanks study testing is low as well. Lower than our first 2 rounds. I want to urge Hoosiers to get tested and to participate in the study. As a reminder, this is the first time the study has looked at children age 5 and above. So we really want to ensure that we capture data that will help us to better understand how COVID is impacting our younger Hoosiers. I understand that people who aren't symptomatic or who might just have a case of the sniffles that attribute that to allergies might not feel that they want to take the risk to get tested, because if the tests are positive, then they would have to isolate. But if we don't know who's positive and take steps to isolate those individuals, we risk allowing COVID-19 to spread unchecked across our state. And that means our lives will be disrupted for a longer period of time. We've done a lot of work to get to stage 5 in our reopening plan, and we can't let off the gas. So please get tested and participate in the Fairbanks study if you've been invited to do so. The fourth of the guiding principles is that we can contact all individuals who test positive for COVID-19 and expand contact tracing. We started with a goal of having 500 contact tracers hired and trained by the end of May. Today, we have almost 700 working. We are on track to have 900 contact tracers in our centralized operation by the end of October. Nearly 350 additional contact tracers are working in local health departments around the state. And Marion County plans to hire 300 more. Many of our colleges and universities are also doing their own contact tracing. Our centralized contact tracers have made more than 400,000 calls and sent more than 630,000 texts since May. Nearly 75% of our contact efforts are successful. Those that aren't get referred to local health departments for follow-up. I can't emphasize enough how important it is to please answer the call or the text. Contact tracers will not ask for your social security number or bank account information. They will ask where you've been and who you have been in close contact with. Please help by providing this critical information so that we can reduce the spread of COVID-19 in Indiana. By now, you're also familiar with our color-coded map that shows at a glance how counties are doing. These maps take the average score of the number of new cases per 100,000 residents in the last week and the percent positivity, then assigns a color: blue, yellow, orange, or red. Blue has the lowest incidence of COVID-19 and red has the highest. As you can see, we have 4 counties in orange this week. Those are Warwick, Spencer, Vanderburgh, and Brown. Sometimes we flag a county because an outbreak in a congregate setting or a single event can elevate numbers but not represent a true increase in the community spread. In the case of Brown County, it was flagged because of low testing numbers resulted in an inflated positivity rate. For example, if you're only testing 2 people and both of them test positive, then that gives you a 100% positivity rate, which impacts your color. It doesn't necessarily mean that there is widespread community transmission. Later today, we will also be loading the school dashboard to our coronavirus.in.gov website. I want to emphasize that this dashboard is still a work in progress, and we will continue to refine the data and collect more data. We started by looking at individual schools and came up with about 2,800 schools in our state. However, as we've been examining the data, we have recognized that there are multiple sources of information about schools in our state. We've been working to remove duplications, and schools that are pre-K only or fall into a category such as juvenile correctional facilities or career centers where cases would be reported by the home school. Because of this work, the number of schools reporting is expected to drop as we shift to school reporting entities, not just individual schools. We'll be making this shift because many schools, or some schools, have separate buildings and need to report by building rather than under one umbrella because students and teachers are never interacting. For example, there's a charter school in Indianapolis that has one Department of Education number, but has 3 separate locations. That school will need to report as 3 separate buildings. A private school here in Indianapolis has 3 Department of Education numbers, but only 1 building, so it will report as 1. And a public school in northern Indiana has 1 Department of Education number, but 2 separate buildings, so it will be reporting data from each building. As I said last week, we expect to continue to gather and refine this data in the coming weeks. So today's dashboard should not be seen as a comprehensive overview of school cases. As of today, 1,359 schools have reported information. Of those, 742 schools have reported one or more cases, and 617 have reported 0 cases. As you can see, 253 new positive student cases have been reported, along with 52 teacher cases and 71 cases among staff. When you add in the historical data that we requested since the start of the school year, that brings our totals to 1,676 student cases, 335 teacher cases, and 343 staff cases. You can search for a school in the filters. If you don't find your school immediately, don't be alarmed. We are working with the remaining schools to help address technical issues to ensure that they are able to report their data. We expect more schools to be included in the dashboard in the coming weeks as we work through this process. I also want to show you how a school with fewer than 5 student cases will show up on the dashboard. Using Bluffton High School as an example, we did last week. Here it shows no new student, teacher, or staff cases, but it has fewer than 5 historical student cases, which are suppressed due to privacy laws. The majority of student cases being reported so far are occurring within our high school students, followed by our middle school students and our junior high age kids, or it would be our elementary age kids. I also was notified that a second shipment of masks has gone out to schools who requested them this week, so be watching for those. Before I turn things over to Dr. Lindsay Weaver for an update on our latest round of long-term care testing, I want to talk about Halloween guidance that I mentioned briefly last week. I know a lot of families and a lot of communities are trying to decide what Halloween trick-or-treating will look like in this pandemic year. The CDC has issued some guidance that describes low-risk, medium-risk, and high-risk Halloween activities. Let me start by saying that if you may have COVID-19, you've been exposed to someone with COVID-19, or you have any symptoms, you should not participate in any Halloween festivities, and you should not give out candy to trick-or-treaters. Every Hoosier needs to be carefully consider the risk that comes with the activities that you want to participate in. The key things I want Hoosiers to remember most are these. A costume mask is not a substitute for a cloth mask. A costume mask should not be used unless it's made of 2 or more layers of breathable fabric that covers the mouth and nose and doesn't leave gaps around the face. Instead, consider using a Halloween-themed mask. And if you're going to a haunted house or any other scary event where screaming might occur, you should stay even more than 6 feet away from others who aren't in your family to reduce the risk of spreading COVID-19. The CDC has broken down the risks of Halloween activities into lower risk, moderate risk, and high risk activities. Lower risk activities include things like carving or decorating pumpkins with members of your household, carving or decorating pumpkins outside at a safe distance with neighbors or friends, decorating your home, doing a Halloween scavenger hunt where children are given lists of Halloween-themed things to look for while they walk outdoors from house to house, admiring Halloween decorations from a distance. Having a scavenger hunt style trick-or-treat search with your household members in and around your home rather than going house to house. Moderate activities include participating in one-way trick-or-treating where individually wrapped goodie bags are lined up for families to grab and go while continuing to social distance, such as the end of the driveway or the edge of your yard. Having a small group outdoor open air costume parade where people are distanced more than 6 feet apart would also be a moderate risk activity. Attending a costume party outdoors where people are wearing protective masks and staying more than 6 feet apart. Going to an open air one-way walk through haunted forest where appropriate mask use is enforced and people can remain more than 6 feet apart. Just keep in mind that scream factor that I mentioned earlier. Other options include visiting pumpkin patches or orchards where people use hand sanitizer before touching pumpkins or picking apples. Wearing masks is encouraged or enforced, and people are able to maintain social distancing. And having an outdoor Halloween movie night with local family and friends with people spaced 6 feet apart. The highest risk activities are participating in traditional trick-or-treating where treats are handed to children going door to door, having trunk or treat where treats are handed from trunks of cars lined up in parking lots, attending crowded costume parties held indoors, going to an indoor haunted house where people may be crowded together and screaming, going on hay rides or tractor rides where people who are not in your household are joined with you. Many of these higher risk activities are the ones that we normally associate with Halloween. And I'm not trying to be the Grinch or maybe more appropriately, the witch who ruined Halloween. But I don't want COVID-19 to take that role either. So know your risk and plan accordingly. Get creative and have a fun and safe Halloween. Now, Dr. Weaver, can you give us an update on the long-term care testing?
Yes, thank you, Dr. Box. Good afternoon. As previously discussed, the Indiana Department of Health quickly recognized the inherent risk COVID-19 posed to Hoosiers residing in long-term care facilities. As we identified the risk of asymptomatic spread from nursing home staff to residents, we began testing asymptomatic staff at nursing homes with outbreaks in April. As more testing became available, in June, we tested over 46,000 staff. 36,000 were directly tested by the Indiana Department of Health, and the additional 10,000 tests were provided by individual facilities. In addition, we partnered with Probari and the Fairbanks School of Public Health to formally study the data to determine if we could use county prevalence, facility type, or staff type as a way to do more targeted testing approach. When this analysis did not reveal a clear way to target our testing, we undertook again to test all the staff at the end of August into September. Through the second all-state testing initiative, the Indiana Department of Health tested over 40,000 staff, with an additional 7,000 tests provided directly by facilities, for a total of 47,641 staff being tested, with 573 positives, making it, again, a positivity rate of 1%. Starting on September 2nd, long-term care facilities are now mandated to screen staff with tests based on their county's positivity rate and for outbreak testing. Facilities were provided antigen testing machines, testing kits, and funding from HHS to be able to provide that testing. Additionally, facilities who are in yellow and red counties are being prioritized to be provided Abbott Bionex cards that can be used for screening. The Indiana Department of Health has supported this testing initiative by providing easy electronic data reporting so they can fulfill reporting requirements and guidelines on how to interpret those results. Additionally, the Indiana Department of Health identified labs who had additional capacity to establish direct connection for follow-up PCR testing. The Department of Health continues to provide testing support to facilities for outbreaks if they have not yet established lab connections. We also provide support with our infection prevention specialists who are deployed across the state to evaluate and educate facilities on their infection practices. A few additional words about the Abbott Bionex Now cards. These cards are rapid COVID-19 antigen tests that provide results within 15 minutes and do not require a machine. Earlier this week, the White House released information about the National Distribution Plan. These testing cards are already being distributed directly to long-term care facilities, as I mentioned, in counties with elevated positivity rates. Additionally, we have received notification that Indiana will receive 130 Bionex cards by the end of the week and expect to get 2 million over the next several months. The State Department of Health will continue to prioritize tests for our most vulnerable populations, including those in congregate settings, and will also work to pilot how these tests can best be used for schools. Thank you.
Thank you. Before we go to the Lieutenant Governor, you want to just underscore about Halloween, about the local recommendations as well. You gave our state perspective, but
right. I think it's really, really important to remember that depending on the amount of community spread you have, your local public health individuals, along with elected officials, may decide differently with regards to Halloween. So we have given some state-based guidance, based very heavily on CDC's guidance, but you need to look to your local public health officials also.
Curious to what your costume will be. We'll have to wait to be continued.
Haven't decided, Governor.
And now you've got some updates on ag and the arts and disability recovery grants.
Thank you, Governor, for this opportunity to provide some updates on several of the agencies I oversee. As Lieutenant Governor, I serve as Secretary of Agriculture and Rural Development. And agriculture is big business in Indiana, contributing over $31 billion to our state's economy. Indiana is the 10th largest farming state. So today we are pleased to announce a new grant program offered by the Indiana State Department of Agriculture to support Indiana's meat processing facilities. $4 million in CARES Act funding has been allocated to the Indiana Meat Processing Expansion and Development Grant Program to improve the food supply chain, expand processing capacity, and promote worker safety. This is a 50% matching grant program with the maximum amount capped at $150,000. Grants will cover eligible costs incurred between March 1st and December 30th due to COVID-19. Funding is available for existing processing businesses that employ 500 or less employees. Applications will be available online via the Indiana State Department of Agriculture website, and questions should be directed to ISDA. To learn more, visit isda.in.gov, and applications will be available Monday, October the 5th. Also today, I'm excited to announce a new grant opportunity to help Hoosiers with disabilities. Governor, in your 2020 State of the State address, you shared your vision that Hoosiers with disabilities be able to live and work in safe, affordable, and accessible environment. And less than 3 months later, the COVID-19 global pandemic would require you to declare a public health emergency and take steps to reduce the spread of COVID-19. As public services went virtual and public spaces were temporarily closed, Hoosiers with disabilities experienced a significant disruption to the in-person services, social spaces, and workplaces to ensure community inclusion. Through our new Community Connections for People with Disabilities grant, city, county, and incorporated towns can develop innovative solutions to mitigate the COVID-19 related barriers to community and workplace inclusion. This grant is being made available through a collaboration between the Indiana Office of Community and Rural Affairs and the Indiana Division of Disability and Rehabilitative Services. $4.9 million will be made available from the CARES Act for this program. Grant awards will be capped at $200,000 for virtual or technology-assisted activities targeted at one of the following: internet access and technology equity, or social isolation and lost access to natural supports, such as friends, family, and community networks. Applications will open on October 23rd, but information for planning purposes can be found online now at in.gov/OCRA, O-C-R-A. Serving Hoosiers with disabilities is a priority of mine and of yours, Governor, and we work to ensure that Hoosiers have equal access to opportunity in life, particularly during this COVID-19 epidemic. And the final grant we are discussing this afternoon is an update to the Arts, Cultural, and Destination Marketing Organization grant, which we first announced in August. This $10 million grant program provides operating support to local festival organizations, theaters, museums, performing arts, arts councils, and a wide range of other Hoosier attractions. Today, we're pleased to report that there will be 479 Indiana organizations across the state who will be receiving funding through this program. Now, the recipients won't be notified until tomorrow, October 1st, and a list of the recipients will be available tomorrow at in.gov/arts. This program is part of a new partnership with the Indiana Destination Development Corporation and the Indiana Arts Commission. And we appreciate the work that has been put into helping preserve our annual community events, festivals, fairs, and expos, and other gatherings, because these events are essential to communities to improve the quality of life and elevate and maintain local arts and cultural organizations during these very trying times. So thank you, Governor, for the opportunity to provide those updates. But what I am particularly proud of is the collaboration and the partnership between our state agencies to be able to serve Hoosiers during these very challenging times.
Thank you for your insistence on making sure all three of those are priorities and for your passion and your leadership. Dr. Sullivan, you want to give us an update on our virtual students and their access to one of the basics?
Thanks for having me today. Last week, Dr. Box mentioned an effort that we had underway for a second round of pandemic food assistance for qualifying students partaking in virtual learning. As you will recall, the first round occurred in the spring and allowed for children who qualify for free and reduced lunch at school to receive the funding equivalent for that directly onto a SNAP-like card for non-SNAP families and the SNAP card itself for SNAP families. That was about $320 per student, or $6 a day. For the spring semester, FSSA distributed nearly 600,000 cards and $188 million of food for kids. Our goal was to make sure that kids who suddenly found themselves at home and away from the services that schools provide still had access to ample food every single day. On September 1st, the USDA announced a fall release of more pandemic EBT funding for a subset of students learning virtually that was required to be complete today. Unlike round one, where all eligible students qualified as students were completing their school year virtually, round two was not as simple, as school districts and students have multiple types of remote or hybrid options that may not qualify. To capture the right students, the state would need to submit a roster of all virtual learners, not just virtual schools. This detailed information was not readily available within existing resources at the Department of Education, which meant we needed to contact each and every school for their latest roster of virtual students and build from scratch a new platform to securely submit this data to the federal government. Today, I'm happy to update that through the heroic efforts by our state schools, our superintendents, and multiple state agencies, Indiana was able to successfully submit data for approximately 1,600 schools, equaling 261,758 students and $42 million in food funding directly to families. Again, that is more than 260,000 students who are learning at home because they have medical conditions, a household member who is high risk, or a community that is not ready for in-person school due to community spread. And we are making sure that they have access to food. I'd be remiss if I didn't offer a special thanks to our partners at the Department of Homeland Security, who took contacting all schools on as an agency-wide effort, essentially repurposing their entire agency for 2 days, including Director Cox, who even made calls to schools in his hometown of South Bend and was able to reconnect with an elementary school friend who answered the phone as an administrator in one of the South Bend schools. Because of their efforts, the second day of data collection added 1,000 schools to the reporting roster. We were one of only 20 states to have a plan approved by the federal government to even attempt this work, and one of only a handful to successfully implement. Cards will be mailed to every recipient starting in mid-October, and we are cautiously optimistic that Congress will reauthorize this program to continue for the fall and spring, meaning our work here puts us many steps ahead for future rounds of funding. Also, just a quick update, as part of our statewide Operation Food effort, approximately 80 National Guard Indiana soldiers will continue to support all 12 food banks located throughout the state as a safe transition to volunteers and also a community kitchen. The soldiers are supplementing the new and returning volunteers. Thank you to the 550 new volunteers that were recruited in just the last 3 weeks. And they will ensure a smooth transition back to volunteer service, which was the eventual goal from the start of the Guard's temporary food bank mission. Through the start of the coronavirus pandemic and through the end of August, the Indiana National Guard helped distribute 33.9 million meals to needy Hoosiers. Thank you very much to all of the dedicated efforts across multiple agencies and for the support that you give us, Governor Holcomb, for this essential and important work at FSSA. Thank you.
Thank you. You're getting it done. Lieutenant Governor Crouch just mentioned October 1st, which means it's the fourth quarter, which means 'tis the season, which means 'tis the flu season. And then you might want to just comment on the confluence or the, flu, COVID coming our way, colder, what that might do to rates.
Right. So every year, our hospital systems get some of them on diversion because their ICU beds, their ventilators, their critical care areas are filled with influenza patients. So this year, especially with COVID-19, we want to make sure that we have as few influenza patients in the hospital as possible. So it's a really important year to get your influenza shot. I think I know somebody who got their shot recently.
Trying to practice what I preach.
Which is awesome. I know my husband's already gotten his and mine's scheduled. So I would encourage all Hoosiers to go out and get your influenza shot so that we can keep you out of the hospital. And God forbid we won't need those hospital beds either for COVID-19, but just in case we do.
Yeah, and Dr. Kaufman, you might want to elaborate a little. You and I had a pleasurable opportunity to meet yesterday. You proved it doesn't cost anything to be kind, even when you have a shot to administer. So we have proof and evidence of your kindness on film, I think.
So, Governor, you ready to get your flu shot today?
More ready than ever.
Excellent. Well, it's one of the best things you can do to prevent yourself from getting the flu this season. Are you feeling well today? Any fever, any illness, any sickness?
I feel fantastic today.
Great. And any previous problems with getting flu shot or vaccination in the past?
Not today.
Awesome. No history of Guillain-Barré?
Nope.
Awesome. Well, we're going to get you vaccinated for the flu.
It's that easy.
It's that easy. How's your arm feeling today, Governor?
I feel like I could throw a pitch.
Fantastic. Well, thank you, and good afternoon, Hoosiers. I'm Dr. Michael Kaufman, State EMS Medical Director with the Indiana Department of Homeland Security. Since the beginning of this pandemic, our EMS system and our ambulance providers have remained operational. Just like police rush towards the sound of gunfire, firefighters rush into a burning building, our EMS professionals across the state will respond to call for medical assistance from Hoosiers, and we do this about 2,500 times per day, totaling nearly 900,000 patient encounters per year, even for those with COVID-like symptoms. Despite those COVID numbers, and really due in large part to the consistency of wearing masks, our EMS workforce has remained operational with a very low impact in our workforce throughout the pandemic. EMS has long been regarded as a pillar of public safety, and that will never change. Our EMS providers are a highly skilled and highly trained workforce, standing at the ready with the skills, equipment, personnel, vehicles, education, and training, ready to respond to whatever emergency they might encounter. As pre-hospital healthcare has advanced over the last several decades and public health needs have grown, our emergency medical professionals all over the state now find themselves standing at the intersection of public safety, public health, and healthcare. It's time we engage them more proactively to not only respond to emergencies in someone's time of need, but to work within our healthcare systems, our public health agencies, in the delivery of chronic care management and community health. This is known as community paramedicine. I'm excited to tell you all today about a new community paramedicine initiative that we've been working to develop across numerous state and county agencies that, without a doubt, will impact the health care of Hoosiers in their own communities. With seasonal flu approaching and more vaccinators needed, with the COVID vaccine expected in 2021, and with more children falling behind on their childhood vaccinations and immunizations, EMS providers and their agencies across the state are in a unique position to engage in vaccine delivery across all three of these needs. Vaccine administration has long been part of our EMS scope of practice at the paramedic and advanced EMT levels, but really infrequently utilized. EMS providers exist in every community, whether that be a town, a city, or at a county level, and they're really perfectly positioned to help with this effort. Over the last several weeks, IDHS, IDOH, and FSSA have been working together with local health departments and EMS provider agencies to stand up 2 vaccination pilot sites that will be administering seasonal flu vaccine to residents. During each Wednesday in the month of October, Indianapolis EMS, our state's largest EMS provider agency, will be working with the Marion County Health Department and will be offering flu vaccinations at the Shepherd Community Center in Indianapolis. Likewise, a similar pilot program is being created working with the Crawfordsville Fire Department and the Montgomery County Health Department to provide seasonal flu vaccine to interested students in their community school corporations. Both of these pilot programs are perfect examples of the ways that EMS can proactively engage in non-emergent care within their jurisdictions in an effort to promote healthier communities. In fact, more than 85% of our surveyed EMS provider agencies across the state are interested in starting similar programs. IDHS will be meeting with these EMS provider agencies over the next several weeks, promoting these programs in areas of need. This has been a truly collaborative effort, bringing together multiple state agencies and local health departments to help address a public health emergency. We're excited to share that with you today. So thank you.
Thank you, Dr. Kaufman. Okay, you want to jump right to the,
One correction. I
Yes.
just wanted to clarify that.
What did I say?
No, it was, it was Dr. Weaver and I think. So the Bionex Now cards that we're going to get, we'll get a total of, we expect about 130,000 tomorrow, not 130. I think we just left off a few zeros, so I just want to clarify that for you.
Yeah, perfect.
Sherry from the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Box. I was hoping you could address the recent statistics, which in the past week, I hate to say it, looks like they're actually going in the opposite direction from what you would have hoped for opening for stage 5. Our hospitalizations are up above 900 and have been staying there. Our cases seem to be, our average number of daily cases seem to be increasing. How does that connect with the fact that we're now in stage 5 and we haven't even probably been in there long enough for that to be having an impact?
Well, you want to talk about when you back up the dates, 2 weeks or 4 weeks, and
I think that's a good point, Sherry. It's not from going to stage 5, certainly that has been the source. But if you'll remember back in about the 3rd week of August, we showed you the huge peak that we were having in our young individuals. I would say anywhere from 19 to 30, but really it's truly those 18 to 25-year-olds had really peaked. And what we are seeing now is a significant peak in our 40 to 50, 50 to 60, 60 to 70-year-olds. Unfortunately, that 2.5 week period of time, this is when we would tend to see them get sick and end up in the hospital, so I'm sure that's contributing. We also are seeing some increased cases per 100,000 down in the southwest corner of the state. We are also having outbreaks in the Kentucky kind of northwest corner and lower southeastern part of Illinois. And a lot of those individuals come to the hospitals there that border the river down there and are hospitalized oftentimes in Indiana. But realistically, you're correct. We are seeing an increased number of cases, and that's why yesterday Dr. Weaver, the Chief Medical Officer, got on the call with all of the hospital systems that are in District 10, the Preparedness District, and talked with all of the CEOs and the Chief Medical Officers. They are all reporting increased numbers of cases in the hospital. They are all doing extremely well and did not feel like they needed anything additional from the State Department of Health at this point in time, but know that we're here to help at any point in time that they would need it. And then at the same time, Pam Pontonis, who is my state epidemiologist, and I got on with our local health officers and administrators from that same district and talked with them about what was going on, encouraged them to have their healthcare providers, as Dr. Weaver did with the Hospital Association, to encourage those things that we know that can make a difference, like mask wearing, social distancing, washing your hands, staying home if you're sick, getting tested if you are symptomatic or a close contact, and certainly engaging with the contact tracers when we call. So something that we've noticed and have already been addressing.
Yeah, and that's kind of the proactive when you're getting on the phone talking to folks saying, what can we change to control the outcome? But it's also, Sherry, we also track, you mentioned hospitalization rates, we also track our capacity to treat those who are in need of care. And we track those just as closely as the other indicators.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. How are you doing today?
Doing good. Yourself?
Good, good. Question for you, Governor Holcomb and Dr. Box. I wanted to drill down a little bit on Indiana's positivity rate. Compared to August averages, the state didn't make much progress in terms of daily cases or deaths across September. The main change that we saw over the last month really was on the testing side, with big increases in testing and decreases in positivity. My question is whether you feel those gains in the positivity rate were driven by broad testing across the state, and therefore a good reflection of if we've somewhat hit a maximum cap of COVID spread, or if it's really been more localized and compressed in a few areas with things like routine surveillance of athletes or college students. I guess my question boils down to, with the improvements in the positivity rate, do we feel like that's been a broad statewide thing, or is perhaps this rate being somewhat artificially suppressed because we're doing more retesting of people who generally aren't sick and haven't necessarily been exposed, and that's driving up testing numbers at a rate?
So I think it's an excellent question. I think it's a combination of both. I think that when you look at screening, surveillance testing is not truly reported. So if somebody's doing surveillance, we are not getting that surveillance. It's a little different. But when you're screening individuals, as some of the universities are and other areas, we do get those tests, the positives and the negatives. And they do reflect a certain amount of community spread, right? Because those individuals are in the community using the restaurants and the bars and going to the retail establishments, et cetera. So I think it's a combination of both of those. It's interesting when we watch these things, we can see certain areas pop up as being hot spots and, work with the local officials there and the local public health, and they clamp down, do some more messaging, work in different ways, and they'll get it cleared up. And then the next, week or two, it's another area of the state that pops up. So I think this is the way this is going to be until we are able to actually immunize individuals to try to help with this.
Yeah, I agree. It's never just one thing. At times it feels like whack-a-mole when you're looking at these maps from one week to the next, and you're looking at a positivity rate that was 3.9 days ago. It's 4.1, 7-day positivity rate average. But just to underscore what you said, sometimes when folks are really extra vigilant about doing everything they can to control the spread, and then folks let up because they're celebrating a low number, then you can see it spike again or surge, and that's where we come in and surge with resources and remind. But it could also be different congregate living settings that we just have to address. And as you mentioned at the outset, the younger folks and that ripple effect or downstream, we have to make sure that we're doing all we can at the origin of the outbreak.
And it's important to note that we do have lots of universities back and colleges back. We do have 96.5% of our schools that are back, with most of them being full-time in person, but at least partly virtual. So those are big gains and big moves for us, and it is a delicate balancing act.
Yeah, and I would say that is the balancing act between the lives and the livelihoods and the gaps that occur if our students aren't in a school classroom that's safe. And we're proving that can occur, as we suggested it could in July.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. I want to kind of follow up on Sherry's question. She noted some of the data that's moving in the wrong direction, but I want to ask specifically about spread rate. 2 weeks ago, it was 6th best in the country. Now it's 4th worst in the country.
Yep.
Why doesn't that make you rethink going to stage 5 when we haven't even seen the impact of stage 5 yet?
Yeah, we went from 0.94 to 1.1, and it just shows the volatility of the spread rate and what we need to do to be extra vigilant. But it doesn't mean that we go back to 4.5 or 4. It means we need to hunker down in the areas where we see spread, and that's what we're doing.
And I think it just is critical that it underscores the need for us to continue wearing our masks, washing our hands, socially distance, not going to work or school if you're sick, getting tested, and engaging with our contact tracers. That's how we prevent the spread.
Kathy with the Ferdinand News.
Good afternoon, Kathy.
Good afternoon. I might probably have 10 questions, but I'm going to narrow it down to 2 if that's okay. And my first would be, because one of my counties is orange, are they supposed to, like if there's a football game or a soccer game or whatever, did I read it right that if it's orange, there should not be spectators, or what is the protocol? High school sports is huge here. And that would be my first question.
It is Indiana.
It is Indiana.
Everyone's
and it's
going
the
pro,
fall,
so.
and everybody enjoys going to a good football game or volleyball game or soccer, and I understand that. Those were recommendations that came along with the colors that we made, and kind of suggested that as the community spread starts to increase, as the number of cases per 100,000 increases, you might consider things like only parents being there, or considering just having the athletes there themselves.
Yeah, we see, Kathy, before your second question, if you're squeezing 725 people in a stadium that holds 750, you shouldn't be surprised. You had a second question, Kathy, of your 10?
Yes, I'm just curious. I've been curious. Do we have the statistic of how many health care workers have died through this? I know that I know of at least one in my area, and I just wondered if that is a statistic that is being tracked.
I'm sorry, Kathy, that is not information that I have or that we have tracked.
Hannah News with Adam Van Onsdal.
Good afternoon. Thanks for joining us.
Thanks for having me, Governor. I wanted to ask you, when it comes to schools and COVID, your administration has favored a posture of respecting local communities as they respond to the conditions on the ground. But one exception to that seems to be close contacts. By defining close contact as anyone within 6 feet for at least 15 minutes, lots of students are being pulled out of school for 2 weeks of quarantine. And we know schools are doing everything they can to keep students within the buildings through pods and then de-densifying their campuses through hybrid schedules. With stage 5 now in effect, are you open to easing the definition of close contact, specifically by allowing schools to redefine close contact as within a radius of 3 feet instead of 6 feet?
Yeah. You want to talk about how facing a direction matters and masking matters and distance still matters. We can't suspend the laws of physics here.
So even with the fact that we said between 3 to 6 feet for the students to be sitting together, we ask for them all to be focused and face the same direction. But if an individual is sitting there for longer than 15 minutes within that 6-foot distance, we still are using the CDC's definition for a close contact. And I realize that's been frustrating in the event that individuals have masks on. We just do not have the data right now to show that that spread is so low that that's a safe thing to do. And we have had this discussion with many school systems across the state, and I understand that. When we have looked, the percentage of students in an overall school system or school quarantined or sick is still a very small percentage. And my goal here is to be able to keep school open in person so there can be students in the classroom being taught, not just virtually. So we are going to continue to follow the CDC's guidance and guidelines until further evidence-based information comes out to change that.
Meredith with WLFI.
Meredith, good afternoon.
Good afternoon, Governor. I was wanting to see if you had any kind of an update on Miami Correctional Facility. Has there been any changes in protocol, and is there an update on how the spread is doing or how many inmates have tested positive? And I was also wondering how those numbers are taken into consideration when it comes to this rate and positivity rate, and if that's taken into consideration in the county that they're located.
This is Kristen Dosh, Chief Medical Officer for Indiana Department of Correction, and I risked my life to get up to this podium today.
She has on high heels.
My foot went asleep. Okay. Yes, so Miami Correctional Facility, I'm actually really proud of Miami and all the work that's being done there. As of this moment, we currently have 5 incarcerated individuals that are COVID-19 positive. I don't have any staff in the hospital. I don't have any patients in the hospital. I think that we've been able to have increased communication, not only with the leadership at the facility, but with the community local officials. And we have a good plan in place, and it's obvious that it's working so far. So I'm proud of the progress there at Miami.
Meredith, you want to repeat your second question, because she was focused on sticking her landing, not the second part of your question.
It's not Dr. Box laughing, and I was like, did I say something wrong? Sorry.
I wish you could have seen what we saw.
let me see where did it, okay. Yeah. So like, is there, how is this kind of taken into consideration when you're, I guess, tabulating the positivity rate or the numbers of cases in an actual county? Like when you're considering that? I think that was my second part. I think you answered the other two. Yeah.
Sure. So if I'm understanding correctly, it's just how are the Miami Correctional Facility numbers taken into account to the community numbers? Is that right?
Yeah.
Okay.
They're not technically, walking around the community. They're not actively participating. So I was wondering if those are still taken into the same kind of account, I guess.
Sure. So Indiana Department of Correction, we report those numbers within a 24-hour period to the Indiana State Department of Health. So my assumption is that the numbers would be lumped together within ISDH data, and then from there, how that's reported out either at the county level or the state level, I would have to defer to those officials. What I can say is last time I talked to Miami County Local Health Department, they were reporting that information out at that county level, kind of separated, right? So they were showing this is the community spread, this is DOC numbers, but I don't know the latest.
You want to talk about the different, and why tracing is so important, because while the offenders aren't out and about walking around,
your employees are, right? So they're a part of the community. They go home to their families. So it is really important that those numbers are included with the county numbers and with the state numbers. But that's why you'll see on our map oftentimes that there's actually a little alert over a county if there's a significant percentage of their positive cases that are coming from congregate living, whether that is at Miami Correctional or Putnamville or whether it is a long-term care facility. So those numbers do get counted in because your employees are out living in the society.
That's right.
Thank you, Dr. Dawes.
Dan Klein, Wish TV.
Afternoon, Dan.
Afternoon, Governor. I'm going to switch gears somewhat dramatically. Two questions. First is just, what's your reaction to watching the presidential debate last night?
I did. That's my reaction.
All right, well then I would have...
Never been prouder to be a Hoosier.
Okay, fair enough. I'd like to focus then on specifically on one moment that has gotten the most reaction from a lot of folks is when the moderator asked President Donald Trump to condemn white supremacists, militia groups, and tell them to stand down. The president eventually told one of those groups, as you saw, the Proud Boys, to stand back and stand by. As a fellow Republican, what is your reaction to that exchange? Do you agree with his response?
I condemn white supremacy in no uncertain terms. I could not be more blunt. I've said before, I'll say it till I'm blue in the face, that the only thing supreme about white supremacy is their stupidity. And I won't tolerate it here. I'll speak for myself. I'll let others speak for themselves.
Elizabeth with WNIT Public Television.
Good afternoon, Elizabeth.
Good afternoon. What advice do you have for families and neighborhood leaders who want to encourage members of their community to participate in those lower risk Halloween activities? And will the state be doing any extra messaging leading up to Halloween?
Yeah, you want to?
So I would encourage my community. I live almost right at the end of a cul-de-sac to kind of, close off that area and let different individuals put tables there. If I've washed my hands and I'm wearing my mask and I put together little baggies full of candy or treats and I space them on the table and I'm well distanced away from them wearing my mask, I can see them parade by in their cute costumes and, I can see their pumpkins on their doorsteps that they've done. So I think that there are ways that communities can band together and do that safely. I think it is important as you're walking around in a group that you kind of walk with your social bubble, your family basically. But I think that people can do that safely. So I would encourage people to look at your community, look at your streets and make it as safe as possible. But if you have underlying health conditions, or someone in your home that you live with has underlying health conditions, or if you yourself are sick or a close contact, you should not participate.
Yeah, rain check next year.
Lindsay Erdody with the Indianapolis Business Journal.
Afternoon, Lindsay.
Good afternoon, Governor. Was wondering if you could share your reaction to the court ruling from yesterday that extends the deadline for when absentee ballots can be returned in order to count.
Yeah, we'll let the legal process play out as we always do, and we'll respect not only the rule of law, but the rulings of the court.
Brock Turner, WFIU.
Afternoon, Brock.
Good afternoon, Governor. Good afternoon, Dr. Box and everyone. I have two questions here. The first is for one of the doctors. I'm not sure who wants to tackle this one. But there's new ISDH guidance that was set out and published 5 days ago or so that says all long-term care facilities, and I'm quoting, must provide outdoor visitation and may provide indoor visitation. I'm hearing from caregivers and multiple ombudsmen across the state that the State Department of Health is not enforcing this. Are you? And if so, how? And what are you doing to sort of prepare for colder temperatures where outdoor visits aren't particularly feasible?
Yeah, thank you. That's a great question. So we have actually, from the State Department of Health, permitted and encouraged outdoor visitation since the beginning of June and indoor visitation since the beginning of July. Then just several weeks ago, CMS came out with their mandated information about visitation, and therefore we updated our guidelines on our website to correspond with what CMS came out with. So again, our infection preventionists, and we work very closely with the long-term care associations. We have biweekly phone calls with the long-term care facilities, work with them to really work through what does visitation look like, how can we do it safely, and when our surveyors go out, when our infection preventionists go out, they are seeing whether or not they're doing visitation. And of course, we always take family complaints or concerns, and we'll follow up on those. So thankfully, we have not really seen spread from visitation, and we've heard really great stories from our long-term care facilities that they're doing a good job with it.
Thanks, Lindsay.
Lindsay?
I apologize.
No.
Brock.
It's Brock. Yeah.
Sorry, my bad.
No, that's okay. Did I cut you off?
No, we thought you dropped, but
We had a technical problem.
yeah, Rachel's literally raising her hand for once.
So I just wanted to follow up on a couple of questions from earlier. For this one to Governor Holcomb, for the past several weeks, and then again today, you all kind of pointed to younger folks socializing as being a primary means of spreading coronavirus. So I guess why open bars and nightclubs now then with stage 5? Doesn't that send the wrong message?
No, they can do it, and they can do it responsibly, and many are. And I see it with my own 2 eyes. So it's just making sure, that Dr. Box has said 3 or 4 times today that the local community is also very involved in this. And I've been very proud to see in some university towns, they're reacting very quickly to this ripple effect. And they're clamping down. And this is not a joke. This is not, they're not in denial. And so those decisions to make sure that they're addressing folks who are flaunting or ignoring good recommendations and advice that keeps those rates low, I think those will serve as examples.
And they're not really wide open, right?
That's right.
I mean,
Yeah.
they have to socially distance.
Yeah.
We've recommended that it be socially distanced tables in the bar, not wall-to-wall people. Some counties have limitations on the length of time that the bars can be open, the socially distanced tables at restaurants. So some people have said to me, we've gone to stage 5, everything's back to normal. And I'm like, no, it really isn't, unfortunately. And we know that that's still a burden for a lot of our individuals that have restaurants and bars, but we do feel that's an important way to prevent the spread.
And I think, Brock, when you look at the map and you look at stage 5 and you see there is a lot of blue, there are a lot of people doing this the right way. And so it's a big state, but what we can do is learn from one another, and we can hopefully all be blue, not just in the face.
Our final question is from Abdul Hakim Shabazz with Indy Politics.
Bring it home, Abdul.
Not a problem, Governor. 2 questions for you. At what point does our positivity rate need to be in order to lift our mask mandate, based on all the data and the numbers that you folks look at? And number 2, any worry or concern that as we get into the colder weather, and folks are congregating indoors, that the positivity rate may actually go up and actually lead us to taking us back to stage 4.5 or stage 4?
Don't want to do it, but we've said the data will drive all of our decisions, and we've been very transparent about that, and we've always expressed our, the concern, but we haven't set an exact percentage, whether it, we've said we'd like to hover below or around 5%. but we didn't wait for that to occur before we went to stage 5. So, yeah, we track a lot of different indicators and a lot of different numbers, but haven't made up. This has to do with capacity, indicators, all the above, really, and our actions and our behavior.
And masks are really the way to keep us where we're at.
And we see that, in states around us, and you see how volatile this is. I always talk about, the things that I read about mutations, and, you just got to make sure that we're doing all we can. And it's almost, to paraphrase JFK, what can I do for my state? Not necessarily a state for me.
Thank you for joining us. That concludes today's briefing.
Eric Holcomb and state health officials giving us an update on the coronavirus across our state. This is 965 new cases have been reported today. The governor is saying we are staying in stage 5. We'll have much more coming up today at 5 and 6 and online at wishtv.com.